Good day, everyone. I am Dr. Tomio Petu, a public health physician. This is my reminder to you to stay safe, keep your homes clean and pest-free. Also remember to wash your hands regularly, and if you feel ill or any of your family members, please remember to see a healthcare provider first. Keep listening to Solutions Clinic.
My name is Olatoye Ujo Baba Funke, LGA Supervisor for Breakthrough Action Nigeria TB Intervention. Tuberculosis is real. Everyone is at a risk of contracting tuberculosis. So, my sister, please check that cough. My brother, check that cough. Check the night sweat. Check that weight loss. TB testing and treatment is free at any primary health center. So please save your life and save the lives of those around you. Keep listening to Solutions Clinic on Solutions 93.9 FM. Thank you.
It's a beautiful morning right here on the Remedy Dial Solutions 93.9, exactly 23 minutes gone past 9. Welcome to Solutions Clinic, where we get to talk about health, everything of course, and anything health. My name is Victor Richard. Hope you had a great weekend, and it's interesting to note again that it's the last day in the month of July. So by tomorrow, I'll be saying Happy New Month. God has indeed been faithful. I did mention earlier that we're going to be talking about cervical cancer this morning, and streaming live on Facebook as well as YouTube at Solutions 939 FM. So do well to jump in on the platform and send in your questions. The essence of these conversations on health is because we want to educate, enlighten, and also receive feedback. That way we can know for a fact that you're understanding what is being thought, as well as help you with the needed questions and concerns that you have regarding these health matters. So send a message on the Facebook platform at Solutions 939. Make sure to like, comment, and share. You can also drop a message on WhatsApp or regular text to 0904 422 2939. 0904 422 2939. Of course, my doctor's in the studio and he'll do justice to this question. So, by way of introduction this morning, approximately 1.1 million new cancer cases occur each year in Africa, and this is according to the WHO, with about 700,000 deaths. The WHO also says the mortality rate is set to increase to almost 1 million by 2030 without urgent and bold intervention. Cervical cancer is the fourth most common cancer in women. Back in 2018, an estimated 570,000 women were diagnosed with cervical cancer worldwide, and about 311,000 died from the disease. Vaccination remains low in Africa at 21% coverage. About 99% of cervical cancer cases are linked to the HPV infection transmitted through sexual contact. When diagnosed, cervical cancer is happily one of the most successfully treatable forms of cancer. My guest this morning is Dr. Olumide Obatoyi. Good morning to you, Doc. It's great to have you join us again.
Good morning. How are you?
I'm very well. It's been a minute. How was your trip?
It's a Nigerian trip. What do you think?
Fair enough. But I think they're fixing the road right now, so it should be better.
I did, really.
Right. Anyway, I just came in from Lagos yesterday. Usually when I come in like early hours of the day, so the road is usually free, so I don't experience traffic as it were. But let's get right into the conversation of the day, cervical cancer. So I guess my first question will be, are there telltale signs at the early stages of this cancer that informs women to really pay attention to?
Yes, there are.
Okay.
There are. The most common and the most frightening probably will be vaginal bleeding.
Discharge, okay.
Abnormal vaginal bleeding usually.
Okay.
And oftentimes there's something particular about this vaginal bleeding. It's often after sex. Most times it's after sex.
Just immediately.
after sex. Some
Interesting.
and then there's often towards the end, in some cases in the early stages, there's this very, very bad odor from the discharge they get. They have this vaginal discharge, which is very, it smells kind of fishy in a way. That you can get. Those two are very, very peculiar telltale signs for cervical cancer. I mean, other signs can come from whether or not the disease has progressed beyond the cervix, has affected other organs, but those two in particular, once you see in an age group, a reproductive age group, especially in advanced aged women, and you start to see bleeding after sex, it's one of those signs that one must pay attention to. It's not always the case anyway, but it's one of those signs that we pay attention to. Yes.
Very well said. Early detection is crucial for better outcomes, it's been said. What screening methods are available for cervical cancer, and how often should women get tested for this?
Well, the most common, the most readily available in the Nigerian system is what we call pap smear. We often try to educate people about it. I think in terms of education, I think we are still not there yet.
I mean, with the percentage WHO is releasing, it shows.
Meanwhile, cervical cancer is really a disease of the developing and the underdeveloped world. Right? Because of this very aggressive screening procedure, aggressive screening policy in developed world, they barely see these cancers anymore. And when they see them, it's so easy to treat. You spoke about treatment. In terms of cancers, when it comes to cancers, there are no bad cancers, there are no good cancers.
Of course.
But when it comes to cancers, this one is one of the better ones.
It's fair.
It's one of the better ones. However, because we don't have a very aggressive approach to it, our screening is not altogether very solid. I mean, how many centers really in this city, as big as this city is, how many centers really do pap smear? We don't have so many of them, and we don't have people going there for those screening. So they come down with cancers almost all the time. It's very, very common.
So is it as a result of not having structures set in place for, the pap smear, or some level of negligence, as it were? Well,
you can only be negligent of something you know about. You'll be surprised people don't know these things. And sometimes, we educate people. I do a lot of public enlightenment and all that. And there is never a time I go out to enlighten the public about sometimes even basic diseases, and I'm not stunned as to how little they know about these things. I mean, you see those things and you just assume people know, and they are careless about it. They really don't know. They actually don't know these things. Some of the questions people ask when we are speaking on radio, you can tell that they actually don't know these things. So, one, we have the challenge of people not knowing. I don't know how best to bridge that gap, but there's this deficit.
I mean, this is one avenue to which we can reach out to people.
Heavy deficit of
knowledge.
Then, outside of that, how many places can they get this screening? How many of these places can they get this screening at either free of charge or subsidized? Because these tests are costly. And the way Nigerians are survival animals. And I say that in the sense that if it is not bothering you, then don't do anything about it. You spend money to eat first. So if something is not bothering you, why go after it? So we have that, and we also have the fact that people don't know about it. So if we can find a way around that. We can go on a large scale pap smear testing and all that. It's there are some NGOs I think I follow on Twitter. There's this doctor who does it. I think it's in Lagos also, and things are a lot easier in Lagos, I guess. You probably have a lot of people to fund you, and all that. So it gets people. They go on mass screening of young people for pap smear, and I think it's exceptional. Or if we can do something like that on a national scale, on a state scale, on a local government scale, maybe we'll start closing the gap a little bit.
Absolutely. I think this is a clarion call to, government stakeholders in the health sector, also to NGOs, particularly here in Ibadan. We need to have, campaigns such as this, organizing pap smear screening for women, because judging from the statistics we're seeing from the WHO, it's very low. And it brings me back to the conversation of vaccination, because this is where it begins. So let's even talk about vaccination and how it is essential, because from my research, I learned that it begins from before you start indulging in sex.
Yes.
So let's talk about that.
Well, the basics is this. Most cases of cervical cancer, I think you mentioned 90 something percent, will have the involvement of the human papilloma virus. So a virus always sets the stage. All right. So the way to counter a virus usually is to have been vaccinated, because these viruses are quite easy to get in any way. So when vaccination comes into play, and the way vaccination comes into play is it's always better before sex, because the idea of vaccination is to get the body immune against a particular disease. So when you are already doing things that would get you that disease, vaccination becomes less potent. All right, I don't know if that makes sense.
Yes, of course.
So vaccination becomes less potent in that aspect. So it's always best to get it done before then. Some in the Western nations, they start as early as age 9, because they are very pragmatic people. They know from teenage years, when people go to prom and all that, they do a lot of sexual stuff and all that. So you start as early as possible. But then we have a challenge in Nigeria, for instance. I think the last time I checked the prices of these vaccines, there are two separate types. There's one that is 30,000 naira per dose.
Okay.
There's one that is 60,000 naira per dose. That was the last time I checked. Now, my point is, I'm here thinking, how much really is the minimum wage if you are going to tell someone to vaccinate his children, right? Because he can't vaccinate his wife.
Assuming he has 5 girls.
He has 5 girls. so you are telling this man to spend 150,000 naira. He's not going to do that.
Realistically.
Realistically, he's not going to do that. So even those in the middle class, the so-called middle class, educated first degree, second degree holders, have not been vaccinated. Why? Because 30,000 naira per dose is a lot of money. Whichever way we want to look at it, whichever spin we want to put on it, it is a lot of money. 60,000 naira. How do you fork out 60,000 naira so easily for maybe 2-3 doses? That's 180,000 naira.
That's right.
Economically, this is difficult. I don't know if there is a way it can be subsidized, or possibly because there is no aid on it, as against say, polio and all that. Possibly because there's no aid on it. That's if we had to pay for polio vaccines and all that, a lot of people will not get vaccinated, right? So I think this is one of those aspects where we can't, the government cannot pay for it. Let's be frank about that. The government cannot pay to vaccinate its people for HPV. I think the best way is to go through the other vaccination systems also. Let's find a way where the international bodies, they are the ones who make it anyway, the way they can help us with this. Otherwise, we will keep
it still behoves, the government to come into play, because if we have these international organizations support, it has to come through the government as well. So the government they do have a pivotal role to play
the government
in
is
this.
the most powerful advocate of of the common man. It's the most powerful arm of government. It's the most powerful advocate. It's the government that can get anything done. Really, it's the government that can do that. So I think if we are going to do that on a large scale, I was when you told me about it, I decided to just compare the numbers with the Western nations, and we are so far behind, man. We are so far behind. Some of these people might not exactly even know what cervical cancer looks like. Yeah, they might just have read it. Some of their practitioners may just have read it. And all
Does
that.
it have a look?
When I say look, not necessarily physical.
Physical.
I what clinically what you see.
Okay. Okay.
If you walk into a ward or something where a patient with cervical cancer is, you are likely, before seeing the patient, you are likely going to be able to stage a guess.
From physical appearance?
Smell.
Oh.
This smell is awful.
Are there symptoms, because I also read that only after you mentioned, of course, that there are symptoms at early stages. Whilst I was researching, I saw that there were no symptoms at all for you to exactly know if you're dealing with it. That's why screening is important. So, aside the smell, I want to know if the smell is related to any of the disease as a symptom. So you start seeing this, you don't assume that it's something different. Do we have other diseases that are somewhat intertwined to receiving smells like that?
We have a lot. We have a lot. And this is the problem with cervical cancer. When it comes to abnormal bleeding, abnormal vaginal bleeding, with cervical cancer, it can happen before menopause. It can happen after menopause. So you are not too certain in that aspect. If it were, say, endometrial cancer and all that, it only happens after menopause. In fact, if you see any bleeding, we always say it, if you see any vaginal bleeding after menopause, you are likely thinking of an endometrial cancer. In that aspect, you are likely, very likely going to have. But with cervical cancer, it could be in any age group from 30. It's very rare under 40, 45, but it happens. So you are looking at 45 to 50. You are looking at, say, 40 to 50. You are looking at that age range. The age is the first thing that gives it up. You are looking at, if you see a 20-something-year-old with bleeding after sex, you are not likely going to start thinking a cervical cancer. It might be on your mind, but it's the very last thing. There are some other things that it might be. So there are those things we tie together eventually and start saying, well, I think I suspect it here. So let's do a test, let's do a biopsy, let's find out. So if you now have the appropriate age, you have the appropriate age, you have the vaginal bleeding, and then you have the discharge, the offensive smell and all that, you have that discharge, you are really beginning to think about cervical cancer. Then there are some other things that are attached to it. So some other risk factors. For instance, if that person began having sex very early in life, early, we call it sexual debut, very early sexual debut, this is a very high risk situation for cervical cancer. If you have someone who has multiple sexual partners, and this is where it gets interesting. That person might have just one husband, just one partner, but then the husband has
several women.
Several women. So,
life is really unfair if you think about it, because you're trying to safeguard yourself, and someone is putting you in trouble.
By association, that person has multiple sexual partners.
Goodness.
By association, So if you are in a polygamous home, for instance, you have multiple sexual partners. You are not the only one there. You have multiple sexual partners. And of course, if the person has immunodeficiency diseases, top of which is HIV, all right, that, it reduces the immunity, and then the HPV is able to stay longer. The interesting thing about HPV is most women will have it at one point in their lives. Most women will have it. So it's 70 to 80% probably. but it is such a disease that the immunity can always take care of it. Within months, weeks to months, it enters the system, it dies. Because the body can always take care of it. But a few people, instead of dying, it just goes quiet, and after a few years comes back as a cancer. Okay, those are the ones who then have cervical cancer. So if your immune system is now very poor, inadequate nutrition, diseases, long-term diseases, you then have you are at a disadvantage. You have a disease that can come in at any time, and then you don't have enough tools to fight it. Right, so you're at a disadvantage. Of course, smoking too is one of those problems too. It's one of those risk factors. So when you now see the age, you see the symptoms, you now see any of these risk factors, you really start thinking of cervical cancer. Yeah.
That makes sense. Well, you're listening to Solutions Clinic right here on the Remedy Dial Solutions 93.9 FM. I'm speaking with Dr. Olumide Olbatoyi. My name is Victor Richard, and we're talking about cervical cancer this morning. I'm open to receiving your feedback, your questions and messages. For WhatsApp or regular text, do text to 0904 422 2939. 0904 422 2939. If you'd like to call into the studio to ask a question regarding cervical cancer, do call 0909 888-9939 or 0912-222-2939, 0909-888-9939 or 0912-222-2939. Let's talk about the HPV virus right now, particularly as it concerns the men. You know, they would say cervical cancer is a woman's disease, but I'm trying to understand the impact it has in the life of a man, because I mean, cervical cancer is transmitted by sexual contact. Great, and this happens between a man and a woman, which means the man.
Our cultural
yes, of course. Which means the man possibly would have gotten the HPV as well.
Yeah.
Doesn't that do anything to the man?
Of course it does. It might be a little more, the consequences might be a little
lenient, okay,
less drastic. But HPV causes, for instance, genital warts. It's a very stubborn disease to treat. Genital warts. It causes genital warts in both men and women. It can be very disfiguring to start with, and I think that's what really bothers people when they get it. It disfigures. It disfigures a lot. So there is that, and unfortunately, use of condoms have not been said to be 100% protective of the HPV. So that gives you a context about that kind of virus. Viruses are generally very, very resilient. They are very resilient, and they are everywhere. So for a man, can get genital warts. In some cases, you might get anal cancer too. It's not very common, but you can get anal cancer too. For women too, it might not go beyond warts. You might just have genital warts too. For women, it might not go beyond that. It might just be that, just genital warts. And while it is difficult to treat, it's always a better bargain, you know. One thing I keep telling people in clinic is, number one, while I don't do morality in clinics, when it comes to sex, if you are going to have sex around, you know, outside of your partner, or you are not married or something, let your sexual space be very protected. Be very jealous of your sexual space. Know your partner very well. Know what he does, know what he's able to do, know where he goes, and all that, for your own sake, not to find out.
Not because you're insecure or anything.
For your own sake.
Well, can you actually know these things? Because people are wonderful. Someone will be doing something under your nose, and you know, well, I mean, you can see telltale signs that something is probably off. But can you exactly know that, you know, they're actually cheating or? It's a crazy word, and it's quite unfair, honestly.
I think it's possible to know. I think if you are very, very aggressive about
Your health.
yeah, you can know. You can know, and all you need to do is protect yourself. Protect yourself. I keep telling people. I think I was
Even married, how do you do that?
well. If you are married, if you're polygamous, I'm not married, so honestly,
I mean, that's fair enough if you want to plead the fifth. But I'm just saying that, a married woman, for instance, who, I don't see how that dynamics would work in a married
I mean, you can't choose who
woman's life. Yeah.
you can't choose who
Yes.
you sleep with and all that. But for I'm really on the side of the singles now.
Yes.
Guys who are not married. I go to food court and some of these places, and I see condoms out there. There's a lot of them. There's so many different flavors. And flavors.
Flavors.
No, that's what they are called. That's what they are called, actually. Different. I know that. So I'm thinking, why don't you just pick one up? If you are that kind of person, at least have one in your wallet. Okay, maybe not wallet. Oh, that does not cause problems. So, have one around at every point in time. Your sexual space is way too important for you to just live to
Mess
chance.
around.
Live to chance that way. There was this fake tweet on Twitter. This weird medical influencer. I don't know if you were following yesterday. He wrote a tweet about HIV. That I think he said Red Cross ran an HIV screen, and 60% of people in Abuja that they ran it for came out positive. Red Cross denied doing such a thing. But
It was a fake.
yeah,
Okay.
I think this influencer, one of these influencers. I got that he was just trying to rush retweets and all that, but it was making some sense. There was a point there, and the point is we are really, really careless with this thing. We are really, really careless with this thing, and too many people have these things in their systems. If people have HIV, imagine if people have HPV. It's so common. So I believe we have to be a lot smarter with things like that. How much does it cost? How much does condom cost? Does it really cost a lot?
Pay attention to these things because the complications that comes or implications that comes with being infected outweighs whatever investment or discipline you would have right now or you're practicing for your safety right now. Let's talk about vaccination a bit. You already mentioned that it's important or it's usually potent before one indulges in sex. So at what age should a parent consider taking their child for vaccination?
Well, like I said, in the West they give you a cutoff of 9. They start from 9. So down south, or will I call it south, outside of the West, from 11, you start considering from 11.
Okay.
Because you reckon that before the end of teenage years, depending on culture and all that, one might be exposed to sex. So you start from 11. Some people will even say 13. That you can start vaccinating your children at age 13. Whichever way, the idea is before sexual intercourse, because it makes sense. It doesn't make sense after.
Because it won't work.
It won't work. It won't.
So for people who are already indulging and didn't, take the vaccine, the only option they have is screening.
Screening, and that screening also has to be methodical. It has to be methodical. You don't just you don't do it the Nigerian way. We have a way of doing things, and that is once nothing is. It's the way we treat cars too. By the way, once everything is fine in our minds. Once you go for a pap smear screening, of course you'll be told. Once you go for a pap smear screening and it comes out fine, the cells are all right, there's no problem, they'll probably give you 3 more years. Tell you, okay, come back 3 years. If the tests are not conclusive, the result is not conclusive, they might tell you come back 6 months after. So you come back after 3 years, you may say, all right, let's give you 5 years. And all that, you keep coming back and all that. That's how to do a proper screening. And ideally, you're supposed to get yourself screened till possibly age 65. Right. So you imagine the number of times you would have gone to the hospital. If one can do that, if one can stick that on his schedule, for instance, every 3 years you are doing this up to age 65, you are not likely going to have a problem with this cancer. This is not one of those things you are going to fall to. If you are going to get another cancer, if you are going to have problems, it's going to be probably ovarian or something. That one is the one where even doctors sometimes have problems. It's that one that comes when things are almost dying. Where we find out when someone is almost dead eventually. But with cervical cancer, with that kind of level of checking, that level of surveillance, we are not likely going to miss it.
Calm down with it. That's interesting. The numbers again are 0909 888 9939 or 0912 222 2939. We're talking about cervical cancer this morning. I have a couple of messages here that I'll be reading. Good morning to you, Victory, and good morning to the doctor in the studio. This is a very interesting topic, and thank you guys for raising awareness on it. My question is on the vaccine. Is it a one-off vaccine, or are there several doses and booster doses just as we have with COVID-19? This is coming from Tokbe.
All right, it's not a one-off vaccine. And there are about 2 or 3 doses, depending on the type of vaccine. Just like
so it has a type too.
Just
okay.
like COVID.
Okay.
I think we had AstraZeneca, and manufacturers have different types. So there are some that have 2 doses, there are some that have 3 doses. All right. So I think what hospitals, if you are going to get vaccinated for HPV, for instance, I believe that the tertiary hospitals often have things like that. You might not likely see them at your local government areas. So the tertiary hospitals are always the best places to go to for such stuff like that. Yeah.
Okay. All right. There's a quick update for the people. If you're planning on using Secretariat Agodi Parliament Road, please avoid the routes this morning. NLC members have blocked the road based on the protest. So if you intend to use a Secretariat Agodi Parliament Road, please do avoid it this morning. NLC members have blocked the road as a result of the protest, so you might get stuck. So kindly avoid using the road this morning. All right, back to the conversation. Another question here is from Kelvin. What causes the HPV that leads to cervical cancer?
What causes a virus? A virus is an organism.
It's innate. Though. So some viruses are innate, right? Like they live in humans.
Are those viruses? Well, they are microorganisms, but not necessarily viruses.
Okay.
Viruses have to come in. They have to come in. They don't live.
So where are these? The world is crazy. Where are these viruses?
No, they're just around. So, what causes the virus? Well, it's a microorganism. It is not caused in itself by something. It causes something instead of being caused, right? And it can be transferred sexually, mostly sexually. There are some cases that have reported it in virgins and all that, but nobody really can explain how we got there. But let's just accept it as a sexually transmitted virus.
Okay. Mrs. Kelvin is saying, hello to you, doctor. My question is, where can one get the vaccine? And secondly, how much do we pay for the pap smear? I think you mentioned that already.
Yeah, I mentioned the vaccine. The last time I checked for pap smear, I think it was about 10,000 naira.
Per screening?
Yeah, the last time I checked.
Wow. It's quite affordable. I mean, because if I say affordable, it's not everybody. It's well, if you consider how much you would spend going for cancer treatments and all of that, it's affordable. If we're being honest.
For where to get I am not all too certain, but I know that at the very least, the tertiary institutions will have an answer. if you go to UCH, possibly the one at Yemetu, your maternity, it's an obstetrics and gynecology center. So I believe that they should have. If you're outside of Ibadan and it's still in Oyo State, there's another tertiary institution in Ogbomoso. That's Lautech. So I believe those places should have. Then some very big private hospitals in Ibadan should have to. They should be able to get it for you. You can blast with them. They can get it for you.
Yeah. Well, that's fair enough. I hope these responses answers the questions you've sent. Thank you very much to all those who sent in a reply. Finally, before we go, we mentioned earlier that it is treatable. So what are these treatment options?
Well, treatment options depends on
Severity.
Severity, and severity is judged by stage. Every cancer has, people always say stage this, stage this. So every cancer has stages and often ends with stage 4. All right. And at different stages, there are different treatments that one can offer. At the early stages, maybe stage 1 or stage 2, surgical treatment is can still work. They still work. There are some other treatments also. There's one where some either hot or cold instruments can be used and all that, just to help just cut off the parts that are affected. There are some that you might have to remove the entire the cervix. I didn't introduce the cervix properly. The cervix is the tail end of the womb, or depending on whatever orientation you're looking at it, it could be the beginning of the womb if you're looking at it from the end, and it could be the end of the womb, you're looking at the womb from the top. All right, so sometimes they might have to remove the entire womb. All right, that could be the surgical intervention. But when you start getting to cases where it has advanced beyond, you might have to use chemotherapy. Sometimes you might have to be aggressive a little more, and then you get to a stage where when you are in stage 4, palliative.
What's that?
End of life care.
Well, let's hope that it doesn't get there. Thank you so much, Dr. Olumide Obatui, for always being here and educating us on health matters. We do appreciate you coming to the studio this morning.
Thank you so much. It's always an honor.
All right, it's a Rapid Solutions Clinic this morning, but we'll be back next week, Monday, to talk about another subject of health. You can always reach out to me via my email if there's a health subject or topic you would like for me to address. realvicriches@gmail.com. Do send in questions and suggestions on how we can make this a great conversation that you would always want to be part of. Like I would always say, a healthy life is your ticket to wealthy life. Thank you for being a part of the program this morning. My name is Victory Richard.